If you are over 70 and you have noticed burning feet at night, numb toes, cold sensations, tingling, swelling, or even small cuts that seem slow to heal, you may think it is simply part of getting older. Many seniors do. They blame aging, poor circulation, or tired legs after a long day. But what most people do not realize is that your feet are often one of the very first places diabetes begins quietly damaging your body. And by the time the symptoms become painful enough to demand attention, the damage may already be affecting your nerves, blood vessels, kidneys, eyes, and even your heart. That is why this conversation matters, because some of the most dangerous diabetic complications do not begin with dramatic symptoms. They begin with subtle changes in the feet that older adults ignore every single day. Over the past 30 years working with older patients, I have seen this happen repeatedly. A person notices numbness in their toes. Another feels a strange burning sensation only at night. Someone else develops a small blister that refuses to heal. Most assume it is harmless. Many wait months before mentioning it to a doctor, and that delay can change everything. I remember one patient in particular, a 74-year-old man, who told me he thought the tingling in his feet was just old age catching up. He was still walking every morning, still driving, still independent. But beneath the surface, uncontrolled blood sugar had already been damaging the tiny nerves and blood vessels in his feet for years. By the time he sought help, he had lost significant sensation in both feet and developed an infection he never even felt forming. What frightened him most was not the pain. It was the realization that the warning signs had been there all along. This is the part many people misunderstand about diabetes after 70. The body does not always sound an alarm loudly. Sometimes it whispers first. And those whispers often begin in the feet. In today's video, I am going to walk you through the foot symptoms older adults should never ignore, why these symptoms happen, what they may reveal about your blood sugar and circulation, and most importantly, what you can do now to protect your mobility, independence, and long-term health. Because catching these signs early can prevent much more serious complications later. And what is happening inside your body right now may be far more important than you think. One of the biggest reasons dangerous diabetic foot symptoms are ignored is because many older adults believe the problem is only in the feet themselves. They think the discomfort comes from standing too long, arthritis, poor shoes, or simply aging circulation. But diabetes works very differently. What you feel in your feet is often the result of damage happening throughout the entire body. When blood sugar remains elevated over time, even slightly higher than normal, it begins damaging the lining of tiny blood vessels. Think of those vessels like small delivery roads carrying oxygen and nutrients to your nerves, skin, muscles, and tissues. Over the years, excess sugar acts almost like a corrosive substance inside those delicate pathways. The smallest blood vessels are usually damaged first. And the feet are especially vulnerable because they are farthest from the heart and depend heavily on healthy circulation and nerve communication. Now here's where this becomes serious. Your nerves function like electrical wires carrying signals between the brain and the body, but high blood sugar slowly strips away the protective coating around those nerves. As that damage progresses, the signals become weak, distorted, or completely lost. That is why some seniors experience burning sensations while others feel numbness instead. Some feel stabbing pain at night. Others lose feeling entirely and cannot detect injuries, cuts, or infections forming under the skin. I once treated a woman in her late 70s who stepped on a small object in her kitchen and never felt it. Days passed before she noticed swelling and redness spreading across her foot. By then, the infection had already become dangerous. This is why diabetic foot symptoms should never be dismissed as normal aging, because the feet are often acting like an early warning system for deeper problems involving circulation, nerve health, inflammation, and blood sugar control. And the next symptom I want to discuss is one of the most commonly ignored warning signs of all, especially during the nighttime hours. Many seniors first notice diabetic nerve damage when they lie down at night. During the day, movement, distractions, and activity can partially mask the symptoms. But once the body becomes quiet, the signals become much harder to ignore. Suddenly there is burning, tingling, stabbing pain, or an uncomfortable sensation that feels almost like electricity moving through the feet. Some people describe it as pins and needles. Others say it feels like their socks are bunched up under their toes even when barefoot. And many older adults make the mistake of assuming this is simply poor circulation or fatigue from aging legs. But very often this is diabetic neuropathy beginning to develop. Now let me explain why nighttime symptoms are so common. When blood sugar damages nerves, those nerves can begin misfiring. Instead of sending normal signals, they create false pain signals even when no injury is present. At night, when external stimulation decreases, the brain becomes more aware of those abnormal nerve messages. This is why symptoms frequently worsen after bedtime. And unfortunately, poor sleep creates another problem. Lack of quality sleep can increase inflammation, worsen blood sugar control, elevate stress hormones, and place additional strain on the cardiovascular system. So the cycle begins feeding itself. The nerves become more irritated. Sleep becomes more disrupted. Blood sugar becomes harder to control, and the damage slowly progresses further. One older patient told me he thought the burning in his feet was caused by warm blankets. He spent months changing socks, adjusting room temperatures, and trying different creams before learning the real issue was uncontrolled diabetes affecting his nerves. This is the part most people miss. Pain is not always the most dangerous symptom. Sometimes numbness is even more concerning because it means nerve communication is fading completely. A person who cannot properly feel heat, pressure, cuts, or injuries becomes far more vulnerable to infections and falls. That is why older adults should pay close attention to any new nighttime foot sensations, especially if they occur repeatedly. And in the next chapter, I want to explain another warning sign many seniors overlook entirely. Changes in skin color, temperature, and healing that may signal worsening circulation problems. One of the most overlooked diabetic foot warning signs after 70 has nothing to do with pain at all. It involves changes in the skin. You may notice your feet becoming unusually pale, reddish, bluish, shiny, or thin. Some older adults notice dry, cracking skin around the heels. Others realize small cuts take much longer to heal than they once did. Sometimes the feet feel unusually cold even in warm rooms. Many seniors assume these changes are cosmetic or circulation changes caused by aging. But this can be a warning that blood flow is becoming dangerously compromised. Healthy circulation is essential because blood carries oxygen, nutrients, immune cells, and healing support throughout the body. Think of blood vessels like highways delivering supplies to every tissue. When diabetes damages those vessels, the delivery system weakens. The feet often suffer first because they are located at the farthest end of the circulation network. And when circulation decreases, healing slows dramatically. This is where diabetic foot problems can quietly become life-changing. A tiny blister from a shoe may not heal properly. A cracked heel may allow bacteria to enter. A small, unnoticed scrape may gradually turn into an infection. In severe cases, tissue can begin breaking down because the body is no longer delivering enough oxygen to maintain healthy skin. I once cared for an 81-year-old woman who noticed a small sore near her toe. It did not hurt much, so she ignored it for weeks. But reduced circulation and elevated blood sugar prevented proper healing. By the time she sought medical attention, the infection had spread deeply into the tissue. That situation could have been prevented with earlier awareness. This is why older adults should inspect their feet every single day, especially after bathing or before bed. Look carefully at the bottoms of the feet between the toes and around the heels. Pay attention to redness, swelling, cracks, color changes, drainage, or wounds that linger longer than expected. And if your feet are consistently cold, discolored, or healing slowly, do not assume it is harmless aging. Because what happens next when circulation continues worsening can become far more dangerous than most people realize. As diabetic nerve damage and circulation problems progress, balance and mobility often begin changing in subtle ways long before seniors connect the problem to diabetes. This is where the real danger to independence begins. Many older adults start feeling slightly unsteady while walking. Some notice weakness in the ankles or difficulty sensing the ground beneath their feet. Others feel like they are walking on soft cushions or thick padding even when standing on a hard floor. These changes may seem small at first, but they can dramatically increase fall risk. Here is why. Your feet constantly send information to your brain about pressure, position, and movement. That information helps your body maintain balance automatically. But when diabetic neuropathy damages those sensory nerves, the brain receives incomplete or distorted signals. Imagine trying to walk safely through a dark room while receiving delayed instructions from the floor beneath you. That is similar to what many seniors experience with diabetic nerve damage. And after 70, falls can become medically devastating. A single fall may lead to hip fractures, surgeries, hospitalizations, infections, prolonged immobility, or permanent loss of independence. What begins as mild numbness in the feet can eventually affect nearly every aspect of daily life. This is why early intervention matters so much. If you have diabetes and notice increasing instability, numbness, or unusual walking sensations, do not wait for symptoms to become severe. Proper blood sugar management, daily movement, supportive footwear, strength training, hydration, and regular foot examinations can slow progression significantly. One patient told me he stopped taking evening walks because he felt unsure on uneven sidewalks. He thought he was just getting older. In reality, reduced sensation in his feet was already interfering with balance signals. And here is something important many people overlook. The danger is not only falling. Reduced mobility also weakens muscles, worsens circulation, increases insulin resistance, and accelerates physical decline. The less you move, the faster the body loses resilience. That is why protecting your feet is not only about comfort, it is about protecting your independence itself. And in the next chapter, I want to talk about a symptom many seniors feel embarrassed discussing: swelling and pressure in the feet that may signal much more than simple fluid retention. Many older adults notice swelling in their feet and ankles by the end of the day and assume it is simply part of aging. Sometimes it is mild, but sometimes it is your body signaling that multiple systems are under stress at the same time. Diabetes does not only affect nerves and blood vessels. It can also place strain on the kidneys and heart, both of which play major roles in fluid balance. When circulation weakens or kidney function declines, fluid may begin accumulating in the lower legs and feet. And after 70, that combination becomes especially important to monitor. Now, not all swelling is dangerous, but swelling paired with numbness, skin discoloration, shortness of breath, or slow healing should never be ignored. This is where many seniors accidentally lose valuable time. They reduce salt slightly, elevate their legs, or wait for symptoms to improve on their own, while the underlying problem quietly progresses. Before we continue, I want you to do something simple. If you are over 70, or if you are caring for someone who is, type the word feet in the comments below. And if you have ever noticed numbness, tingling, burning, swelling, or changes in balance, let others know they are not alone, because these symptoms are far more common than many people realize. Now, here's the encouraging part. The body often gives warning signs long before severe complications occur. Recognizing those signals early gives you an opportunity to protect circulation, improve blood sugar control, and reduce long-term damage before it reaches a dangerous stage. But the next warning sign I want to discuss is one of the most serious of all, because many seniors never feel it happening. One of the most dangerous diabetic foot complications after 70 is the complete loss of sensation. And ironically, many people think this means the condition is improving because the pain disappears. But in reality, numbness can signal advanced nerve damage. This is where diabetic neuropathy becomes especially dangerous. When nerves stop communicating properly, injuries may occur without triggering pain. A senior may develop a blister, pressure sore, cut, or infection and continue walking normally without realizing damage is forming beneath the skin. This is how small problems quietly become medical emergencies. I once treated a man who wore the same tight shoes for weeks despite developing a wound near his heel. Because sensation had become so reduced, he never felt the pressure building. By the time the wound was discovered, the surrounding tissue had already become severely infected. This is why daily foot awareness matters so much. Not occasional awareness. Daily awareness. After bathing, drying your feet carefully and checking between the toes should become part of your regular health routine, just like brushing your teeth or taking medications. And pay close attention to these warning signs. Loss of feeling. difficulty sensing temperature, burning pain that suddenly disappears, new wounds, drainage, red streaks, blackened skin, or foul odor from a sore. These symptoms require prompt medical attention. Now, let me explain another reason this becomes more dangerous with age. As we grow older, immune function naturally weakens. Healing slows, skin becomes thinner, circulation often declines. Diabetes adds another layer of stress on top of those age-related changes. So infections that might once have healed quickly can spread far more aggressively after 70. This is where hospitalizations, severe infections, and even amputations can begin. But here is what many people do not hear often enough. Most severe diabetic foot complications begin as small, manageable problems that were ignored too long. And the next chapter involves a symptom many older adults completely misunderstand because it does not always feel painful or dramatic in the beginning. Some diabetic foot symptoms do not appear as pain, numbness, or swelling. Sometimes they appear as changes in the toenails and skin texture, thick yellow nails, fungal infections, cracked heels, shiny skin, hair loss on the lower legs, or feet that suddenly appear unusually smooth and thin. Many seniors see these as cosmetic annoyances, but these changes can reveal deeper circulation problems developing underneath the surface. Healthy blood flow nourishes the skin, nails, and tissues constantly. When circulation weakens, the body begins prioritizing vital organs first. Areas farther from the heart, especially the feet, may receive less support over time. That is why skin quality often changes before major complications appear. This is the part many people miss. Even small fungal infections between the toes can become dangerous entry points for bacteria when diabetes is poorly controlled. Cracks in dry skin may look minor but can gradually develop into deeper wounds if healing slows. This is why proper foot care matters medically, not cosmetically. Wash the feet gently. Dry carefully between the toes. Use moisturizer on dry areas, but avoid excess moisture between toes. Trim nails carefully. Wear properly fitted shoes, and never walk barefoot, especially outdoors or on rough surfaces. One patient told me she stopped wearing shoes inside her home because slippers felt uncomfortable against her numb feet. A few weeks later, she unknowingly stepped on broken plastic in her kitchen. She never felt the injury happen. That single unnoticed wound became a serious infection. And before we finish, there is one final area many older adults with diabetes overlook completely: the connection between blood sugar control, nighttime habits, and the future health of their feet. By now, you can probably see that diabetic foot symptoms are not isolated problems. They are warning signals connected to the entire body: the nerves, the blood vessels, the kidneys, the immune system, the heart. And one of the most important things older adults can do starting today is improve the daily habits that influence blood sugar stability and circulation. Because every day of uncontrolled blood sugar quietly increases stress on those delicate nerves and blood vessels. Now, that does not mean perfection is required, but consistency matters enormously. Start with the basics. Monitor blood sugar regularly if your doctor recommends it. Stay physically active within your ability, even if that means short daily walks or seated movement exercises. Movement helps circulation enormously. It acts like a pump, assisting blood flow through the legs and feet. Hydration matters too because dehydration thickens the blood slightly and reduces circulation efficiency. Sleep also plays a bigger role than many seniors realize. Poor sleep increases stress hormones that can worsen blood sugar control and inflammation. That is one reason nighttime diabetic symptoms often become more intense after periods of poor rest. Nutrition matters as well. Many older adults unknowingly consume foods that create repeated blood sugar spikes throughout the day: sugary drinks, refined carbohydrates, highly processed snacks, and large evening meals. Those spikes create ongoing stress inside blood vessels, like repeated pressure surges against delicate pipe walls. Over time, damage accumulates. This is why stable blood sugar matters so much more than occasional short-term fixes. Now, here is another important step. Schedule regular foot exams, not only when something hurts. Even early diabetic nerve damage can sometimes be detected before severe symptoms appear. The earlier problems are identified, the greater the chance of slowing progression and protecting mobility. And if you notice any sudden change, or increased numbness, wounds, discoloration, swelling, warmth, drainage, or rapidly worsening pain, Seek medical attention promptly. Do not wait for symptoms to settle down, because diabetic complications are often easier to control early than later. And in this final chapter, I want to leave you with something even more important than fear. I want to leave you with clarity, control, and a practical path forward. If there is one thing I hope you remember from today's discussion, it is this. Your feet may be revealing important information about your health long before more serious diabetic complications appear. The tingling, the burning, the numbness, the swelling, the balance changes, the slow healing. These are not symptoms older adults should automatically dismiss as just aging. They may be early warnings that diabetes is affecting your nerves, circulation, and overall health much more than you realize. But here is the encouraging truth. Awareness changes outcomes. The seniors who protect their mobility and independence the longest are often not the ones with perfect health. They are the ones who notice problems early, respond quickly, and stay consistent with small protective habits over time. That matters enormously after 70, because protecting your feet is really about protecting your freedom to walk safely, remain independent, stay active, and continue living life on your own terms. So tonight, before going to bed, take one simple action. Check your feet carefully. Look for changes. Pay attention to sensation. Notice any cuts, swelling, redness, or areas that feel different than usual. That small daily habit may help you catch a serious problem before it becomes dangerous. And if this video helped you understand these symptoms more clearly, share it with someone you care about. A spouse, sibling, friend, or aging parent may be ignoring the exact warning signs we discussed today without realizing how important they are. You can also subscribe for more medically grounded videos designed specifically for older adults who want to protect their heart, brain, circulation, mobility, and long-term independence with practical information that truly matters. Because aging well is not about fear. It is about awareness, action, and giving your body the support it needs before small problems become life-changing ones. Thank you for spending this time with me today. Please take care of yourself, pay attention to what your body is trying to tell you, and I will see you in the next video.